Welcome back, everyone. This is the closing panel for the University of Michigan School of Nursing Global Health Summer Institute. I would also like to welcome those participants who are joining us. This panel is sponsored by our PAHO WHO Collaborating Center and is an open session, so free to people who were not participating in the Summer Institute. So since we have some new participants, I'll go ahead and begin with a few housekeeping details. Assuming that I can advance my slides. There we go. All right, so welcome. The title of today's 3 days of presentations is Chronic Conditions in Women's Health Through a Global Lens. As a reminder, the globe button at the bottom of your screen will allow you to choose English or Spanish language for the presentations. You can also use the chat to introduce yourself and tell us what country you're joining us from. Questions for our speakers can be put in the Q&A at any time. We're going to go ahead, since the 2 presentations are linked, we'll go ahead and hear from both of our speakers and then open up to question and answer and thoughts and comments from those of you in the audience. We would like to thank again our planning committee, Jovita Ortiz Contreras from the University of Chile, Andrew Humans, a doctoral student at the University of Michigan School of Nursing, Nora Drummond, clinical assistant professor here at the University of Michigan, and Barbara Getty, a nurse practitioner from obstetrics and gynecology at Michigan Medicine. We would also like to take a moment again to thank all of our sponsors, which includes the library system here, the Center for the Education of Women, the Institute for Research on Women and Genders, the Office of the Provost Global Engagement, and many of the Center for Global Health Equity, and many of our area studies centers here at the university. Since this is the closing session, a reminder about the Certificate of Attendance and Continuing Nursing Education. To receive your certificate, you need to attend the session and then complete the evaluation, which we will be sending after the conference closes. You'll receive an email with the certificate in it immediately after you answer your evaluation questionnaire. Since you'll be able to print or save the certificate right after you submit the evaluation, please try to be at a computer that allows you to download and print. A total of 9.25 contact hours can be earned if you attended the whole Global Health Summer Institute, and there is no conflict of interest for anyone in a position to control the content of this activity. As this is a collaborating center panel, I would also like to remind everyone that the views presented are the opinions of those of us who organized the session and not necessarily the official views of the World Health Organization or the Pan American Health Organization. As a reminder too, we would love it if you share your experiences with the Summer Institute using your social media channels. Our hashtag is at UMich Summer Institute, and below you can see some of our social media channels. All right, with no further ado, we will go on to the panel itself. This panel is organized around the theme of the leadership of nurses in addressing chronic disease in women's health. As many of you know, today is International Day of the Nurse, and the theme this year is Nurses, a Voice to Lead. In honor of that theme, we asked 2 nurse leaders to join us. Over the past few days, we've heard a wide variety of speakers share their research and experiences confronting the impact of chronic disease on women's health. On this International Nurses Day, with the theme of Nurses, a Voice to Lead, I ask us, as we return to our daily lives as researchers, clinicians, educators, and policymakers, how do we respond to the challenges that we have been talking about? How do we lead change. We have asked our speakers to share their thoughts on this theme and to share examples from their own work and the work of their colleagues. After their remarks, we will turn to your thoughts and your questions. That's the slide for questions later. Sorry about that. For now, please put them in the chat, and I will go ahead and stop sharing my screen and introduce our speakers. Our first speaker will be Professor Lilian Ferrer. She is the Vice President of International Affairs at the Pontificia Universidad Católica de Chile. She is a nurse, a midwife, and a doctor of public health. She is a tenured professor at the School of Nursing. She's worked for the last 15 years as the Director of International Affairs at the school. Her areas of research and development have been mainly in the fields of public health, chronic disease, community science, HIV/AIDS prevention, global health, and social movements. I'm going to go ahead and also introduce our second speaker because their presentations are really two parts of one presentation, and then we can move more seamlessly. So our second speaker will be Professor Adelais Markaki, who is a professor and the co-director of the PAHO WHO Collaborating Center for International Nursing at the University of Alabama at Birmingham School of Nursing. She's also the chair-elect for the Pan-American Nursing and Midwifery Collaborating Centers Network. I believe, if I'm not mistaken, Lilian is the current chair, something that was not in her bio, but thank you, Lilian, for your leadership in these past years. The PANMCC, the Collaborating Center Network, includes 14 PAHO WHO centers in the Americas region. She is a strong believer in crossing boundaries across disciplines and cultures, and she strives to develop new connections and empower academic, healthcare, and community stakeholders to achieve the WHO 2030 Sustainable Health Agenda. Dr. Markaki combines advanced practice background in public and community health nursing with a medical anthropologist's perspective on global health. Her international career spans over clinical, administrative, and academic positions, both in the USA and in Greece. As a health systems researcher, she studies nursing contributions to primary healthcare and global health with a focus on capacity building, collaborative practice, interprofessional teaching, and compassionate care. Dr. Markaki has extensively mentored nursing, medical, and public health students and professional nurses. For over 10 years, she has served as the section editor and associate editor for BMC Nursing and Rural and Remote Health, two open access journals with rising impact. In 2020, Dr. Markaki was inducted as a fellow in the American Academy of Nursing. So congratulations, and with great appreciation to both of you, I will go ahead and turn the floor over to Dr. Lilian Ferrer from the Pontificia Universidad Católica de Chile. Thank you very much.
Thank you very much, Megan, and good morning or good afternoon, good evening to everybody. And special congratulations to all nurses today. Such an honor and responsibility to follow Florence Nightingale's legacy. So congratulations on our day today. This week actually has been a wonderful trip through different topics. We thank people who have made this Summer Institute possible, especially the School of Nursing at the University of Michigan. So I'm going to start sharing my presentation. Please let me know if it works okay.
There's a little bit of delay, but actually we're getting a black screen. Lilian, I think you're muted.
It seems like I'm having a little bit of trouble with sharing the presentation. How is it now?
We can see it now in speaker view, but I think that will work.
Yeah, okay, great. Hopefully it works now. So when we received this invitation to talk about chronic conditions in women's health through a global lens, I think that the most important thing from my perspective, besides being a nurse, at the moment, I'm the Vice President for International Affairs. And I keep thinking about how important it is to be having these more global views, and particularly for nurses to really get into international work nowadays. So in the last 3 days, we have been seeing different presentations around reproductive health and chronic conditions, everything related with adolescent pregnancy, critical stage and health opportunities, obesity and diabetes care during pregnancy and cardiovascular disease, preeclampsia and GANA, cardiovascular diseases in early pregnancy, post-conception planning, disparities in care related to peripartum cardiomyopathy. So basically, all the different issues that women go through and problems that they go through in relation with reproductive health and how it connects with chronic conditions. Also, we have been talking a little bit and listening about capacity building and capacity development in research, particularly in relation with mental health and scaling up psychological therapies globally, and of course, implementing science and engaging diverse communities for inclusive research. And of course, another two areas have been HIV and AIDS, that still remains being a huge issue around the world. And of course, global health in terms of global burden of disease and how we need to have better tools and data visualization. And nowadays, of course, thinking about migrant and native women's health in advanced transition countries and what are the socio-demographic factors that are affecting.
Lilian, I'm so sorry to interrupt you. It's a little bit hard to see, and it looks like your cursor is on the button to make this a full screen presentation. Can you just click? Oh. So we were seeing your speaker view. So, that's it. There we are. I know I took you away from your slide, but that view is exactly what we needed.
Yes, okay. It looks beautiful now.
It's
great. Thank you.
Fantastic. So basically, after mentioning the different topics that we have been covering during this week, I think that if we consider all these different topics that deeply connect with nursing care and advocacy, it is not possible to not question ourselves about the future, especially as nurse researchers and educators. Like, what choices should we make as clinicians, educators, researchers moving into the future? Impossible not to consider in finding local solutions, but basically we need to consider and have global views in this era of post-globalization. So I'm sorry, but now my slide doesn't want to move. There we go. So just to give a little bit of a global context, it's important to consider that women have a longer life expectancy than men. However, they have higher morbidity and use of health services. So we need to better understand why. We need to consider that we still have male-dominant societies. And of course, this is highly prevalent around the world. And there are particular areas where this is deeply embedded in societies, and this has an impact in cardiovascular diseases that are the leading causes of death, followed by cancer, of course, and in particularly with women, considering cervical cancer and lung carcinoma, and how that somehow relates with this mental health issues that we go through, violence that women go through, sexual and reproductive health that still is not very well defined. And I think we're still in depth in terms of defining what really it means for women and actually for women to feel really part of it. So in essence, I think that the global context put women generally in a role of high vulnerability. And if we consider that in terms of how There is feminization of care also in terms of having women being in charge of taking care of others, how many social determinants of health are having an impact, and how this physical and emotional wear and tear, giving a high caregiver overload and with an invisible role, all these factors are increasing the caregiving burden. This all increases women's health problems. So basically, in order to care for women, it is necessary to have a holistic and nursing perspective and considering all these factors like this caregiver role, the signs and symptoms of diseases which might be differ from evidence. And this is something that we have learned in the past, particularly in terms of cardiovascular diseases, but we still sometimes do not consider that we do not have a lot of information and data about specific signs and symptoms that are present in women and not necessarily the whole population. Also, this idea of having increased risk of mortality during pregnancy, childbirth, and puerperium, it's still present, and not just in a less developed country, but also in high developed countries. And with the changes in terms of at which age women become women, that's also making a difference. And of course, this idea of a longer life expectancy needs to make us think that the fact that usually women seek more for health services make nurses responsible for not losing opportunities. This week has been wonderful in terms of identifying information, knowing more about what's happening with women and chronic diseases. But please let me share a little bit about Latin America, because I haven't seen a lot of description about Latin America and what's happening in the region where I'm located at the moment. So if I consider Chile, of course, this is in considering the Latin American context, we have 4 main issues around women's health and particularly connected with chronic conditions. First of all, we are having several issues with cardiovascular disease, particularly women having strokes, hypertension. In terms of mental health, is an area where depression is highly prevalent. In terms of musculoskeletal disorders, there is a lot of presence for chronic pain. And in terms of cancer, we have this breast cancer leading the cancers in the region and particularly in Chile. So if we think about what are the risk factors and particularly considering the role of women in Chile and Latin America, make us think that we need to have a nursing view or leadership in caring that needs to have these 3 components. This holistic perspective, considering all the time social determinants of health, but a whole process of innovation in care that needs to be present. So basically, these are competences that we need to give our students or our future nurses. Now, in terms of some initiatives that we have had at UC Chile School of Nursing, that we are a PAHO WHO collaborating center, I would like to share with you that we have been working in introducing the nurse practitioner role in the country. This is something that didn't exist before. So basically what we have been doing, and actually our first nurse practitioner that arrived, put together a No More Fractures program, thinking about women and considering that they needed to broaden the scope of nursing action using the US model. So I'm getting back to this idea of innovating all the time. And this innovation doesn't necessarily mean that you need to create the wheel again. I mean, we have this wonderful model that you have as nurse practitioners in the United States, and we have been receiving support from University of Alabama and Birmingham, University of Miami, University Boston College, and actually they helped us train the first 2 nurse practitioners, and Sandra Leyan is one of them. She came back and she created this No More Fractures program at the UC Healthcare Network with an interdisciplinary team. So basically, she has been able to reduce the risk of having fertility-related fractures and actually also study and treatment of osteoporosis. So basically, considering this model of the nurse practitioner that it's working in the US, we train this person. She's back here in our country and making it more local, adapting it to our context. She actually has been able to have this preventive approach, person-centered care, and actually reach full prevention. So it is aimed at people who have suffered a fracture, have received a diagnosis, seeks to prevent fractures in old ages. Another initiative that we have been, again, having this local view, but I'm so sorry, identifying solutions for the local context, but with a global view, we have also created something that is called Personas Mayores Autocuidándose. So it's like older adults with self-care. And actually, this program has been created by Claudia Bustamante and colleagues. And basically, they have been identifying the deficit of a specific self-care strategies for the prevention of falls among elderly. And actually, people who were not receiving care that allow them to identify risk practices, they have entered this community intervention that it's really focusing on person satisfaction, continuum of care for people in the program. And mainly, women has been the mainly impacted by this because they are receiving these home visits, telephone follow-ups, then home visits again at 12 months. And actually with the possibility of having this plan, monitoring, they have been able to actually reduce the risk for falling. Another initiative that we have developed, also considering the advanced nurse practitioner model, basically in Chile, women particularly, they have been really touched by cancer. And cancer is a critical issue in Chile and the world, but particularly in Chile, it is hard to reach the entire population and particularly women because of geography and the deficit of specialists. So basically, we decided to create a healthcare with a health team approach with the idea of promoting prevention and providing timely treatment. Actually, we are at the moment training advanced nurse practitioners with a focus on oncology, and they actually are standing out for their theoretical and practical knowledge and being able to make complex decisions with greater clinical decision-making skills. Everything with this idea that women are actually seeking for care, but as nurses, sometimes we're losing opportunities to actually do better prevention or giving these women the possibility to reach treatment on time. So basically with these advanced nurse practitioners in preventing fractures, with these advanced nurse practitioners working in oncology, we're actually getting very good results. And actually, I think that it has been really important for us, and again, I insist on the importance of working in networks, and particularly with PANMCC, where we find all these WHO, PAHO, nursing and midwifery collaborating centers. It would have not been possible for us in Chile to actually create this particular program. And at the moment, we are able to train nurse practitioners who can deliver comprehensive, safe, and quality of care. And finally, I would like to mention something that a lot of the times are not very well considered in more developed countries, and has to do with respectful care through a breastfeeding support intervention. Breastfeeding is one, and I would say that it's a strategy or one thing that actually is a protective factor for chronic conditions. And this is something that we have been really working with here in Chile, designing and piloting at the primary healthcare level, a complex intervention to support mothers and their family and partner in establishing and maintaining breastfeeding, thinking about the future. This is a key preventing chronic condition and to prevent chronic conditions. And I think that actually here in Chile, we have been able to combine these theoretical foundations, these key components, and creating an intervention that basically with the idea of having this systemic approach and having strengthening these breastfeeding behaviors, breastfeeding self-efficacy, and of course, health professional self-efficacy, we have been able to have these three components at the institutional, at the professional, and the mother's partners interventions. And actually, at the moment, we have been very successful. And what we are trying to is to reach in the future less chronic conditions for these children. And actually also it has been connected with a reduction in breast cancer. So we're very happy about these programs that we have been associated. We have been using technology, we have been using WhatsApp for follow-up, and we are all the time very engaged with the community. So basically this idea of having this global nursing view nowadays, finding global solutions with global perspectives in an area of chronic conditions with women still underserved, I think that is the message that I would definitely like to pass. And this is something that we have had in mind here in Chile, because we need to be considering different things that have worked in other countries, but also we need to make it a reasonable for our context, with the idea in mind, again, that women are still underserved everywhere in the world, and that as nurses, we need to advocate for them in order to actually reduce these chronic conditions, that it's a huge pandemic that we need to keep working with. So thank you very much for being able to share with you what we have been working on here in Chile.
Thank you so much, Lilian. And to our audience, as you think of questions for the presenters or comments, please go ahead and add them to the Q&A, but we will go ahead and pass the floor and the screen sharing to Adelais Markaki.
Thank you so much. This has been a wonderful opportunity to share this special day with you today and be at the same panel with my good friend and colleague, Lilian Ferrer. So let me share my screen then. Okay, could you confirm that you can see my screen?
Yes, great. We can see it and we can see your slides well.
All right, thank you. So I will follow up and take you on a trip and offer you the 10,000 feet view of women's health through a global lens. And doing this, we're going to look at some of the global events or milestones that shifted the paradigm for nursing and midwifery in the last years, and also be able to describe how the COVID-19 pandemic has impacted women's health indicators in the Americas, since this is a special region of interest for us, and also explain why it is important for clinicians, educators, and researchers to increase their capacity in women's health. And last, to identify some of the strategies that we can use to integrate WHO Sustainable Development Goals with some select health indicators in women's health. So to start with a global paradigm shift, we'll do a quick history review of the last few years that have been really remarkable years for nursing and midwifery. It all started in 2017 with the first appointment of the very first chief nursing officer at WHO, Ms. Elizabeth Iro, who is a nurse midwife with a long experience in public health as the health secretary at Cook Islands. And as the first chief nursing officer during the last few years, she has really seen the shift of nursing and midwifery through critical times. Then in 2018, we had the launch of a significant campaign. It's known as the Nursing Now campaign, which was launched by WHO and ICN. And the triple aim was to promote and improve community health, to overcome gender inequalities, and to enhance the economic development. And the rationale for this is because by developing and investing in nurses, the vast majority of whom are women, new community leaders are created, they are mentored, women gain economic independence and empowerment, and the local economies are strengthened. Then we all know that 2020 was another remarkable year. It was planned to be the International Year of the Nurse and the Midwife. But as we all know, the emergence of the COVID-19 pandemic overturned all of these plans and brought nursing and midwifery into the forefront in a different way. And then 2021 continued to be a turmoil year, with a year when international healthcare workers really needed our support to keep us safe and to keep them safe. And then last, in May of 2021, the World Health Assembly adopted the Global Strategic Directions for Nursing and Midwifery. This is a 5-year plan that sees and sets the directions for both nursing and midwifery at an international level. And it's a landmark report that we all need to be aware of and keep in mind as we move forward. So how then has nursing and midwifery moved from advocacy to evidence to action? Well, the release of the State of the World's Nursing Report in 2020 was very important because it was the first systematic approach to collecting data about how nurses impact not only the health-related SDGs, such as number 3, the health promoting sustainable development goal, but also other SDGs related to education, gender, decent work, and economic growth. And that report calls for an investment in nurses' education, in nursing jobs, and in nursing leadership. And it was launched by WHO, ICN, and the Nursing Now campaign. As part of that report, or in order to compile that report, we needed data. And this was the first time that we had a systematic international approach to collecting nursing workforce data and creating national health workforce portals. And you see here a print screen of the US portal, but similar portals exist for close to 130 countries that participated in this effort. So this is a system by which countries progressively improve the availability, the quality, and the use of their health workforce data through monitoring of indicators that support the achievement of SDGs, universal health coverage, and select health objectives. And it offers a lot of information about nursing education regulation, nursing practice regulation, what are the working conditions, what are the demographics, distributions, nurse mobility, and other things that we really need to know in order for us to be able to come up with a plan for action. So then we all know that the emergence of the COVID-19 pandemic brought everything into a halt initially and then disrupted all the plans. It's the year that global health went local, as we say. So this is where the global thinking and local acting really needs to become part of our education and our practice. And this is why it's so important for nurses and midwives to be aware of those perspectives. It also means that during the pandemic, nurses and midwives tapped into their abilities and their main characteristics. And this is where caring, courage, commitment, collaboration, and creativity came to the forefront. And these are the 5 motivational C's of the pandemic, as they're known. So not only the negative impact of the pandemic, but also the positive impact of the pandemic is important to be in mind. So when we take a global lens perspective and we want to approach this from a global lens view, there are a couple of reports that are important to keep in mind for the Americas region. The first one is the Sustainable Health Agenda for the Americas that was compiled way before the pandemic, but it's a call to action by PAHO, the Pan American Health Organization, for the health and well-being in the region. And we know that this is a region that has remarkable inequalities and disparities in health indicators. And the other report from the region talks about how nurses and midwives contribute specifically to women's health. This report that highlights case studies from different countries is of particular importance. And it's great to know that one of you from University of Michigan, Megan Eagle, has participated and contributed to this report. So let's look then at how the COVID-19 pandemic has affected women's health. Well, first of all, it has affected women at the individual level. And more specifically, it has affected health workers. These are the occupational risks that nurses and midwives have been facing. And given that more than 2/3 of the nursing workforce in the Americas is female, we know that these occupational risks are risks that women face. So a lot of COVID infections at work, injuries from prolonged use of protective personal equipment, exposure to toxins from disinfectants, the increased workload and working hours, the violence, the discrimination, and the stigma that healthcare workers faced throughout the pandemic. And also we know that the aftermath has been chronic fatigue, burnout, and psychological disorders that are happening and developing and will be developing over the next few years. And of course, there has been substandard sanitation, hygiene, and rest facilities with all the implication of those substandard conditions. But we also know that the effect of the pandemic on women's health has been at the systems level. This is because there has been forced, rapid, and emergency policy responses to increase the nurse supply. In January of 2022, a very important report came out by the International Council of Nurses, CGFNS, and the International Center on Nurse Migration. And they ring the bell, the alarm bell for nursing and midwifery workforce, because there are trends that are really worrisome that make us think how we're going to proceed in the next few years and in the aftermath of the pandemic. So sustaining and retaining in 2022 and beyond talks about the redeployment of the workforce and the new responsibilities that were assigned to nurses and midwives. We have seen this in the US with the new responsibilities given to advanced practice nurses and states passing legislation, emergency legislation that allowed APNs to do certain procedures or things that were not allowed before. There has also been a huge variation in the size of the new supply of nurses who are trained domestically across high-income countries. So not all high-income countries have enough supply of nurses who are trained domestically. So as a result of that, there has been an increased active and fast-track international recruitment by some of those high-income countries. And that means that it undermines the ability of the source countries to respond effectively to the pandemic challenges. And we all know who are some of those source countries. They're from the Caribbean region, they're the Philippines, they're from Africa. Countries that cannot afford to lose their trained nursing and midwifery workforce, but who lose the workforce because they're attracted by other opportunities, higher paying, better job condition opportunities. Before 2020, the global shortage of nurses was estimated at 5.9 million. With conservative estimates, this report says that it could be up to 7 million if only an additional 4% of the global nursing workforce were to leave. And we know that retention rates are very low. So retaining our nurses is a challenge, and we need to be able to come up with good strategies to overcome that. Another effect on women's health has been related to the widespread and extensive lockdowns and the social isolation during the pandemic. So women have faced difficulties in accessing health services and care. And we have seen this with prenatal and postpartum care, where there are estimates of 60,000 to 200,000 more stillborns during that period. There are also difficulties with family planning, with an estimate of 20% being more difficult for adolescents to access contraceptive methods. And last but not least, there has been widespread gender-based violence and domestic abuse during those lockdowns. The hotline calls for victims of that violence have increased 91% in Colombia, 36% in Mexico, 25% in Argentina, and Paraguay and Bolivia have the highest rate of femicide in adults and girls in South America. These are really alarming statistics. And that's why the domestic abuse and gender-based violence is also known as the hidden pandemic. So how can nurses and midwives contribute to women's health? What can they do? Well, through their clinical practice, they can start to screen for and treat some of these conditions and look for the early signs and then advocate for their clients. As teachers, they can teach the new generation of nurses and midwives. They can also mentor their colleagues, the junior faculty, who so much need that mentorship and support. And then, of course, as researchers, they can develop the new knowledge, they can apply the new knowledge and make sure that they translate what has been generated and the evidence that exists into health policy. So how do we leverage women's health? We need a systematic approach. So one way around that is to think about sustainability. The efforts we're making need to be sustainable. So one way to view this is through the model of operationalizing sustainability in global nursing. And at the core of this model are partnerships. Partnerships are essential for sustainability. Through their structure, we develop and build relationships and trust. We bridge our cultural differences. We set mutual goals, and we evaluate the availability of resources. Through the processes, we train and educate. We provide leadership opportunities, interprofessional collaboration opportunities, and we advocate politically. This is very important. And ultimately, we have positive changes, and these positive changes will lead to sustained outcomes. And those sustained outcomes will be nurses as change agents who are self-sufficient. We build capacity and we allocate our resources in the best way possible. We also have buy-in from our stakeholders, which is very important to be aware of who our stakeholders are and how we can make them part of the solution. And ultimately, we can have sustainability. So here is an approach to how to leverage partnerships in practice, education, and research through the Pan American Nursing Midwifery Collaborating Centers Network that was mentioned before, or PANMCC, and one individual collaborating center at UAB. So we leverage the resources in a way to advance nurses and midwives throughout Latin America, share resources, pilot case, and coordinate and invest. So the network, as it was mentioned before, comprises of 15 collaborating centers in the Americas region, and it builds on our collective intersectional strengths. It's actually built on diversity, equity, and inclusion, and it's a really good example of DEI. We have a website available in English, Spanish, and Portuguese, which you're welcome to visit for more information. And then we also have a global network of WHOs, or the G and WHOs as it's known. This network at the global level includes 43 collaborating centers, 6 partner organizations, which include WHO, ICN, ICM, which stands for the International Council of Midwives, Sigma, JPAHO, and AfroHealth, which is an interdisciplinary African Forum for Research and Education consortium. And there is one secretariat. So these networks are really very important for leveraging our resources. And I will show you now just a few examples from the UAB WHO Collaborating Center on how we go about that. Our terms of reference are to strengthen the quality of nursing education and practice based on the universal health and primary healthcare principles, and also to build capacity and leadership for nurse and midwife educators by enhancing the use and dissemination of the knowledge resources. We do this through different activities. We won't spend time on all of them. I would just highlight how we build academic nursing partnerships. We build capacity of advanced practice nurses in managing patients with diabetes and cancer, and how we develop interprofessional education for nurses who care for vulnerable populations. So in terms of the academic service learning nursing partnerships in the Americas, a scoping review that we did showed that they're very beneficial for leading impactful change across a wide variety of healthcare settings, and also for students to apply the knowledge and skills learned. However, the majority of the literature is from North America and mostly from the US. That means that there is a lack of geographically broad evidence, which means that the successes and challenges might be culturally biased and will require adaptation of this approach in Latin America and the Caribbean. Next, we developed a series of free access webinars that are housed at our website that you see here, that build the capacity of APMs in managing patients who have diabetes, who are community-based, and managing patients who live with cancer throughout their trajectory, from the initial time of diagnosis throughout survivorship. So these webinars are available for you to review and use, and perhaps include in as your teaching materials, if helpful. And then we also developed a new distance accessible course that focuses on violence against women during COVID-19. As we mentioned before, it has been a real issue during the pandemic. It has been a hidden pandemic. And we wanted to highlight the important role that all the different health professionals, including nurses and midwives, can play in the early screening and also in addressing this issue. This course is available both in English and Spanish for free, and there is a certificate of completion at the end that you can earn. We also offer an international scholars program to build capacity of nurses in the region. And we do this through teaching, research, innovation and technology, or clinical practice. Applicants, scholars can focus on particular areas of interest that they want to build their capacity. And this is a highly individualized program that we offer. And again, this is in response to the needs in the region. We also provide mentoring of PhD students in the PAHO region. And that means that for mentors, they integrate the research and professional skills to prepare leading nurse scientists in the PAHO region, whereas the mentees expand their home institution or country programs of research in new directions. So some takeaways are that there has been a major shift in nursing and midwifery paradigm during the last few years. The pandemic has disproportionately affected women in the Americas, and some of the long-term effects are still to be seen or uncovered. Leveraging the partnerships in women's health requires careful planning, mutual effort and goals, and shared resources. And this can be done through sustained partnerships among the networks which can advance nursing, midwifery education, research, and practice. So I would like to end on this special day, International Nurses Day, with ICN's call for nurses to lead and not to hesitate, to voice their concerns, to voice their contributions, and to advocate for investing in nursing, respecting rights to secure global health. And we would love to hear from you. You can follow us on Twitter, or you can reach out to us if you need more information about any of those initiatives that were shared. Thank you, and I will stop sharing at this point.
Thank you so much to both of our presenters. Going to go ahead and switch to gallery view for everyone. So we end up seeing our whole panel, but then you can see all of us. I'm going to go ahead and begin by sharing the questions that came in while you were speaking. And I think more are coming in, so I will get to them right now. So the first is, and either of you can answer, how do you believe that the social norm, like being a homemaker, influences in women's health care?
Well, thank you. Thank you so much for the question. Actually, I saw it in the chat and I was like, oh, this is still a tough question, I think, because we have certain social norms, and depending on which part of the globe where you're located is how you can organize a better provision of care for these women that are actually staying home. And that doesn't mean that they are not working. They are working, they're working really hard, they are working a lot. And actually, at least what we have encountered in some qualitative research that we have conducted in Chile is that, for example, remember that there were 4 main issues in terms of health for Chilean women, and one was related with chronic pain. And it has been associated by the women with the fact that they are doing a lot of physical work at home. And at the same time, they have been saying, you know what, if I were working outside of the home, maybe I would have not noticed that I'm having this amount of pain, for example. So basically, they are so closed in their homes, not being able to actually communicate or see the rest of the world, that it's really hard for them to focus on something different. So I think that there is a connection with the different types of health-related problems that women go through if they are working from home or if they are working outside of their homes. But the important thing would be that as nurses and as nurse researchers and as nurse clinicians in primary healthcare settings, for example, that you actually work together with these participatory approaches with the women in order to really identify and in order to really have a very good definition of what these particular women need. The other thing that we have encountered, particularly in Latin America, is that a lot of people believe that by being a stay-home mom, for example, it's something negative on itself. And for a lot of women, it has a lot of value attached to it. So I cannot, as a nurse, predispose myself to saying, oh, this is a stay-home mom. She's going through a really bad time, or it's not the best way of living. I mean, for some women, we still believe that that's a great way for raising kids and for having a family. So basically, I would say that my main message is, do not think about yourself and how you define what's good in terms of health and in terms of what's the best women's role in society. You need to work with the women themselves to really identify and define these issues.
Great, thank you. I'm going to skip around a little bit because there's a question in here specifically for you, Lilian, but there's one that I believe is more for Ada, which is, any suggestions for how higher income countries can reverse the stealing of nurses from lower income countries?
I saw that, and this is the $1 million question that if we had the answer to, I'm sure that all the international organizations would be grabbing whoever had the answer. So this is a really issue that, as I mentioned before, was recently highlighted in this report that just came out. So the fact that there is a center on nurse migration that is looking into this issue shows how complex the issue is. There is economics involved. There are social issues and social recognition issues around the nursing profession involved, which also play a huge role. There are also gender equity roles involved. The majority of the nursing and midwifery workforce is female, which kind of feeds into the previous question, okay, about the caregiver role, which is so underestimated and undervalued. All of these things kind of tie together. So one approach to the issue, in response to the question, is that high-income countries need to be very mindful that when they try to fill in their gaps, they're creating gaps elsewhere. And they're creating the gaps in places that are very hard to be replaced. So the approach would be that if we train nurses from low income or low resource countries, because it's not just the low income, there are resources that are low, even in high income areas. And I can think of a rural South in the US, in rural Alabama that I am from, that we have huge issues of deficits with our nursing workforce. So it's not just the low income countries, but when you train them, you want to make sure that you have a plan that they go back and offer back some of their expertise and some of their knowledge. And that's why there could be, for example, rural primary care programs. We have one at UAB where we train practitioners, nurse practitioners from rural areas. And as part of that program, they need to go back for 5 years to provide service to the area that they came from. This is just one way of trying to deal with the issue. Of course, raising awareness is not just enough. You have to offer incentives to people. And this is something that it has to be part of the discussion with our stakeholders. And this is again why it's so important to know who the stakeholders are and be able to advocate. So again, it's the triple aim: nursing education, promoting health, and enhancing gender equality and economic development. That's part of the Nursing Now campaign. That's what the aim was.
Great, thank you, Lilian. I mean, thank you, Ada. I'm sorry, my head is already going to the next question, which is for Lilian and in Spanish, but I need to read it in English so that the audience understands. So this is a question for Lilian. First, thank you very much for the excellent presentation and for the preventative and health promotion programs that your school has carried forth. About the program of community intervention with older women and the prevention of fracture. Is it financed by public or private resources? And have you thought about themes of cost and investment in human resources in terms of expanding the program to other age groups or other settings? And I think we'll see if we have time to get to the third part. I will let you, I think your answer will clarify the question for everyone as well.
Yeah, well, mainly if I can share a little bit, I would say that in terms of the advanced nurse practitioner role, and to be honest, there has no been investment from the public sector, not for this program in fractures, not for the oncology program. Actually, as I mentioned during my presentation, we have been able to reach this stage and actually implement these pilot programs and start working actually with training nurse practitioners in Chile, thanks to the support that we have received from the United States, from different collaborating centers and schools of nursing. So specifically, the question about public or private actually has been private, and actually it has been receiving support from our partners from outside. So basically, thanks to the network that we have been able to start it. Of course, we are having these conversations, and because we strongly believe that nurses should be into policy making, we have been discussing with these stakeholders. As Ada mentioned, it's really important to work with them. So we were able, for example, to incorporate in one of our laws in Chile that nurse practitioners are considered for the care of oncology. We have not been able to accomplish that in terms of reducing fractures or like more in the traumatologist area, but we are in the process of working into that. And of course, since Chile has a mixed system, public-private, we are implementing it with a small pilot in one of our clinical sites that belongs to the public sector. But mainly, to be honest, this has been reached thanks to the support that we have been given by our networks and colleagues from outside of Chile.
Great. Okay, we have a question from Kalo from Japaigo in Botswana, wondering if there's any plan to include webinars like this in the WCEA platform so that nurses can take the courses online and accumulate CPD points. So I think that is something for us as organizers to follow up on, and also for the collaborating centers that have online courses to follow up on. So Kalo, if you want to email any of us with more details, please do. Here's a question for, I guess, all of us who work with but are not the World Health Organization. How can the WHO plan to promote nursing leadership at the country level in low and middle income countries?
So if I can start, the WHO has already been doing quite a few things, and a couple of the strategic directions in nursing and midwifery reports that I mentioned before do exactly that. They kind of set a pathway, which of course needs to be individualized for each country because each country is different. And this is where the portal with the database comes into place, because you need to have your hard data. You need to have evidence to be able to advocate and to call for action. So the first steps have been taken, and they have been initiated by WHO, and the role of the chief nursing officer that I mentioned before, Elizabeth Airo, has been really instrumental in this. There are countries right now, believe it or not, that don't have chief nursing officers. And that means that for some countries, nursing is part of their you know, maybe medical system, maybe somebody else is speaking for nurses, but nurses don't have the voice at the national level. So this is really important to be aware of and try to change it. And this is exactly where the, you know, the World Health report gives, you know, enough information so that we can start making some changes at the national level. And maybe Lilian would like to add to that.
Now, also, I would like to mention, and coming from a country where chief nursing officers are not easy to find, actually, we're able to trigger the creation of that at the Ministry of Health. But to be honest, it's a role that it's almost absent. And I mean, we never listened to the chief nursing officer at the Minister of Health. So basically, nurses are not really incorporated in the decision makings at the Minister of Health level. The other thing is that if we consider healthcare networks that we have in the country, the chief nursing officer at the different hospitals or networks do not exist except for our university healthcare system. And again, I insist, I mean, working in networks and being able to actually have this global view for trying to develop and support nursing development in Chile, it has been really, really important to look into other partners and outside of the country. And not just, and I'm not just talking about like the Northern Hemisphere. I'm also talking about, for example, the development that nursing has had, for example, in Brazil. I mean, Brazil has had a huge development around research, nursing research, and actually they even have one, like the National Institute for Health Research has its NINR. They have something similar in Brazil, and we have never been able to actually promote or have nursing recognized as one of the main research areas around health, particularly in Chile. So again, I think that there are so many things that we need to develop, and particularly in Latin America. I think that we have received support from PAHO, but still we need more support in order to have more PhD trained nurses in the area. And of course, having advanced nurse practitioners also being involved in the provision of care, not just in Chile, but in other Latin American countries. And it's a figure that it's almost absent.
Great. Well, in closing, I would like to remind everyone that Michelle Monroe Kramer has put the link for getting continuation, for answering the post-conference survey and getting your continuing education certificates in the chat. I would like to thank our guests, Adelais Markaki and Lilian Ferrer, for their time and for their excellent closing presentations. And before we all leave, I would also like to give a shout out to Michelle Monroe Kramer, who was the prime organizer of the whole 3 days, for her excellent work on putting on the conference. Of course, to thank the organizing committee, the sponsors, and our wonderful interpreters for ensuring that the keynotes and sessions were accessible in Espanol. And Lilian and Ada, you're getting lots of thank yous and applauses in the chat. Thank you everyone for joining us these past 3 days. And if anyone has any parting words?
I would just like to thank you, Megan, and actually, as we said before, to the University of Michigan and the School of Nursing for all the work that you put together in this. And I would also like to thank everybody today for really working hard for advancing nursing, because I honestly think that it's a profession that really thinks about the well-being of human beings. And so we really need to work hard and keep the tough work that we do.
Thank you. It has been a privilege to be with you, and it's great to see the representation from so many different countries among the participants. Well done.
Well, thank you both. Thank you, attendees. Happy International Nurses Day. And whether you are a nurse or a researcher or a physician, please help amplify the voice of nursing. And we will hopefully get healthcare in all our countries to a better place.
Thank you.
All right. I will leave
Thank you,
this.
everyone.
So thank you, Michelle. Big hand for Michelle.
Thank you, everybody. Please reach out to us at the UMSN Summer Institute email if you have any questions. And we look forward to hearing back from everybody on the evaluation. That is extremely helpful for us as we begin to plan for next year and get the opportunity to see you all again. Thank you again, Ada and Lillian. And I will say goodbye to everybody now.